Can you tell me the branches of the right coronary artery? Yes, ma'am. The right coronary artery, ma'am, it is coming out of the ascending aorta, and it will be having atrial branches and ventricular branches. So that is the easy way to remember the atrial branches and the ventricular branch, like that you can remember. Here again you have anterior posterior for everything. This is an important branch to remember, that is the node, SA node artery, the branch to the SA node. Okay, very important to note. In 60% of people, in 60% of human beings, the right coronary artery supplies the SA node. Okay, branch to SA node. You can see here in 60% of people, this is from the which one? Right coronary artery. Very good. Then there is one artery that you should know here called as the right conus artery. Okay, what is it? Right conus artery. Along with the left conus artery, it makes a circle around this pulmonary trunk. Okay, so this is called as some annulus of Vuissens something. Okay, anyways, right conus artery. Okay, what and all you learned so far? Atrial, ventricular. Atrial only we saw what? Branch to SA node, right conus. Okay, this much we have seen. Okay, then coming to ventricular side. Okay, so basically again anterior posterior we have. I'm telling you everything has anterior posterior. Then you should know here that the right marginal artery, see here, the right marginal artery, it is a branch of the right coronary artery. Remember, the right marginal artery runs along the inferior border of the heart until the apex of the heart. Got it? The right marginal artery. Here they have just said marginal branch. Okay, next, posterior interventricular branch. Finally, this right coronary artery, from here it's going behind also, and finally what it's giving? It's giving one branch. Where that branch is? Posterior. Here at the back. Here at the back. It is there. This is the posterior interventricular branch. Okay, this will supply what? The AV node. Got it? So right coronary artery supplies SA node in 60% people, and what? The AV node. This one at the back is supplying the AV node. So you got right coronary. Okay, it's right coronary. If somebody asks you, what will you say? It has atrial, you remember like this as two big groups. Okay, but atrial, ventricular, then you have this right conus, branch to SA node, the right conus you remember. In ventricular, after that you remember marginal, and this in the posterior interventricular branch which supplies the AV node. Okay, marginal is what? Runs along the inferior border till the apex of heart. Got it right? Right coronary, done. Where does the right coronary arise? Exactly, if they ask, ascending aorta, anterior sinus. Okay, anterior sinus. Okay, good. Now let's move to which one? Left coronary artery. Very good. Left coronary artery. Let's look at branches. Okay, while we are here, let's learn some facts. These coronary arteries, they get filled when the heart is in diastole. Okay, when the heart relaxes, then the blood from the aorta flows into this coronary artery when diastole of heart. Okay, now let's go to left coronary artery. Left coronary artery branches. Okay, here also you divide off into two things. Okay, anterior interventricular branch, circumflex branch. Two things you remember. Okay, here it's not atrial and ventricular. What am I saying? Anterior interventricular branch. Okay, and the circumflex branch. Two things you have to remember. Okay, remember that what am I talking about? Anterior interventricular branch. Okay, now anterior interventricular branch, under that you will get what and all you will get? Conus. Very good. Left conus. Very good. Left conus artery which goes around this pulmonary trunk along with the right conus. Very good. Then you have the diagonal branch. Left diagonal artery. Nothing special about it, they said. Okay, so what and all you saw? Conus, diagonal. Two things are coming under this anterior interventricular branch. Very good. Then coming to the circumflex. Now let us move on to which one? Circumflex. See, this is the circumflex. Circumflex, again, what and all is there? Marginal artery. Which marginal, people? Wake up. Left. Yes, we are in the left side now. I will use this color. The circumflex is giving which branch? Left marginal artery. So marginal means where it should go? It's along the margin, along the border. So along the left border it is going and reaching where? Apex of heart. Very good. Very good. Okay. That's it. This is all you have to remember for circumflex. Only one thing you have to remember. Left marginal. Okay. Is there anything else to remember? No. So again, anterior, posterior, you can say for everything. Okay. So this was what you will remember. Now, from behind, let us look how it will look. Okay. From behind, from the heart behind. Okay, people, from behind, you tell me what and all will be there. Right side. Right side. What are you seeing here? Which is this branch that is coming here? That right coronary only is continuing posterior, right? And then it will give what? It will give the posterior interventricular branch. Posterior interventricular. Remember, it is coming from the right coronary, right? And right coronary here, crux of heart it is supplying, and also what? AV node. AV node is supplied by right. Okay. Then left, what are you seeing here? Left back side, what are you seeing in the left? That circumflex fellow, no, he had given the marginal, remember, along the left border, which will go till the apex, correct? That's all you have to know, okay? Then small anterior, posterior branches, I keep telling you anterior, posterior, you write for everything, okay? One more thing you should remember, in 40% people, only in 40% people, SA node is supplied by whom? Left coronary. So somewhere you have to write that point also, okay? Left coronary, 40% of people only will supply SA node. Am I saying that right? Okay. Now let us look at the counters, okay? Where is right marginal artery? Here. What is it coming from? Right marginal artery is coming from right coronary artery. It is going along the inferior border till the apex of heart. Very good. Where is the left marginal artery? Left marginal artery is here. It is coming from the circumflex branch of the left coronary artery. It is running along the left border of the heart and reaching the apex of heart. Correct? So right marginal artery, left marginal artery, you have understood. What about right conus, left conus? Right conus, left conus, I think we have spoken enough about it. Okay, now you look at anterior interventricular branch that is coming directly from the left coronary artery and it is anterior. Okay, the posterior interventricular branch, it is coming from the right coronary artery. At the end of the right coronary artery, you have this posterior interventricular branch. So anterior interventricular branch comes from the left coronary artery, while the posterior interventricular branch comes from the right coronary artery. Is this much clear? So all the counters we have given you. So who supplies the SA node? 60% people, right coronary will supply. From where are the coronary arteries arising? Ascending aorta. Very good. Very good. That much is enough. Right coronary is slightly anterior. Left one is posterior slightly. You can remember like that. Which one is larger, right or left? Left. Left coronary artery is larger. Remember. When do the coronary arteries fill? The blood flows through the coronary arteries during diastole of heart. Heart must relax. Remember. Coronary arteries, now you are master.